There are many facets of the health information technology industry. One category of the health IT industry is financial processes used by healthcare organizations. The name for these financial processes are the revenue cycle. In the revenue cycle, patients can have different methods of paying for healthcare services, such as through insurance companies, government agencies, and self-paying for these services. There isn't usually a set price for healthcare visits and encounters because patients come to the healthcare delivery systems with varying degrees of needs, such as illness severity, number of hospitalization days required, and types of medications prescribed. Despite all this variability, healthcare organizations must gather its fees in a time-scheduled manner, otherwise their employees, healthcare providers, and vendors won't get paid. A fishbone diagram is a useful tool to identify specific breakdowns in a revenue life cycle. Diagramming these exact processes using the fishbone technique is a good way to visualize the process by which healthcare organizations collect their money and distribute it to their workers. This diagram goes to show you just how intricate this process is. There are many stakeholders associated with the revenue cycle. These include team members from the pre-encounter, encounter, post-encounter, claim generation, payment posting, follow-up, and self-pay collection teams. Today I will role-play a team member from the self-pay collections category. Hello, I work in the self-pay collections department. There are many steps I must take in order to complete my tasks. If I fail at any of my steps, it puts my healthcare organization at risk of not being able to pay its employees. If my organization can't collect these funds properly, I am in big trouble because myself and others may lose our jobs. This is why I always ensure that each task in my department gets done. The first step in my tasks is collecting statements and letters. Part of my job is also to be there as a customer service resource. I help talk patients through their payment statement and letters so they understand what action needs to be taken to pay off their medical service bill. I then participate in a duning cycle process, which is communicating with self-payers that their outstanding account balances are due. This can range from gentle reminders to threatening letters in the mail and/or phone calls. After this, the payment is captured. In-house processes for ensuring collections is also implemented. I help patients set up payment plans if they cannot pay their medical bill all at once. If the payer does, and I unfortunately go through the process of issuing patient dismissal warnings and official letters if the payer does not successfully pay. I then work alongside collection agency companies who pursue the unpaying patient on our behalf to gain back some of the payment from unpaying patients. All the tasks I mentioned, I perform to ensure that the money due ultimately gets to my healthcare organization, so they can distribute it to their employees properly and in a timely fashion. Thanks for listening to my portion of tasks for the revenue cycle. I hope you enjoyed it and learned something new. Bye for now.